So you have a woman who has a black daughter, and she is, white, and she's detailing about, because her daughter basically followed her footsteps because she works in healthcare, and her daughter's going to deal with what a lot of black healthcare professionals have to deal with, unfortunately, dealing with racist people. Let's go ahead and roll that.
Racism in healthcare definitely exists. And if anyone tells you it does not, they are a liar. And my daughter just experienced it for the first time today. I cannot tell you how many times I have been called to a patient room because, one, either the patient feels like the nurse that is African American is incompetent and does not know what they are doing, or two, they just do not want an African American nurse for no reason at all. I also cannot tell you the amount of times I have had to chastise or reprimand a white nurse because they are not giving an African American patient the exact same treatment or care that they would give a white patient. So my daughter is doing clinicals, and she went in today to do an echo scan on a patient. This patient, she said, was in her early 90s. White patient. The patient had her daughter in the room with her. My daughter is biracial. So to the world, of course, she is perceived as African American. They went in to do the scan. The daughter and the mother immediately looked at my daughter and told the preceptor, my daughter's preceptor, who is white, that they did not want my daughter to do the scan. They did not want my daughter to touch their mother, her mother. The preceptor said, I'm not sure what is the problem. She's very competent. I am right here. If anything, is done wrong, I can correct her. The daughter proceeded to say she did not care. She did not want my daughter to do the scan. She did not trust it. She did not want my daughter to touch her. The preceptor pushed her for what was the problem. The daughter finally admitted it's because she's African American. She does not want her touching her mother. She does not feel like she is competent enough to do the job. My daughter looked at the preceptor. The preceptor again advocated that she's very competent, that she's right here overseeing. The daughter insisted she didn't want her to touch her. The preceptor said, it's fine, I'll do it. My daughter stepped out of the room. She did not get disrespectful. She actually went to the car and called me. She was in tears. She was so upset. Now, my daughter is a lot like me. My daughter actually wanted to go the off, but because she knows she is a professional in a professional setting, she walked out and she came to call me.
This particular incident right here is why a lot of black people don't even go to the doctor, to be honest with you, or don't even want to go to the hospital. Not only the daughter who's trying to help, they don't want her just because she's black, not because she's don't know anything, not because she's not, doing the job right. No, just because she's black. And even with the white person saying, no, she good, I got her, if anything wrong, I got it, they don't care just because she's black. And, with time, I guess as I've gotten older, that level of ignorance I don't have patience for. And if I worked in healthcare, you didn't want me because I'm black, I'm like, oh, cool, no problem. Hey, Sarah, you got that patient over there you need to go deal with. Why? They don't want me because I'm black. Cool with me. I stay over here on my phone. I am fine because I'm getting paid regardless, and stay right there. You wouldn't make me go in there and deal with no patient that doesn't like me because I'm black, because you're creating a hostile work environment, and I'm not here for that. That's number one. But the second thing that this lady said that really, got on my nerves, when she said that she had to get on white nurses for not giving black patients the same level of health care they'll give a white person. And that's why, right there, some black people don't even like going to the hospital. Right there. Black people need medicine, black people in pain or whatever, they don't give them certain medication. But a white person badly complain they're in pain, they give them so much medication that they get addicted to it. And now they got an opioid addiction. You understand what I'm saying? Notice the opioid addiction is tearing up the folks' community. It's not tearing up ours. It's just that simple. Racism, white supremacy is in every industry. Every industry. Healthcare being one of them. You talk about everybody want to focus on the cop. The cop is not the only one. The firefighter, that's one too. Paramedic, the nurse, the doctors. As long as them folks are in control of something, they bringing in their anti-black bias into it. This is why For the life expectancy of black people, we got to go to black healthcare professionals and be under the care of black people. It's been proven that our life extends in America when we have a black doctor. Something that simple. For the health of our people, we need to get us a black doctor. And if we can find a place where they got a good hospital with a lot of black people, that's what we need to be in America, unfortunately. Unfortunately. These people, no matter what they say, they're raised to have anti-black racism. We cannot live nowhere near them and never done them a thing. And they just don't like us for the simple fact that we black, because there's nothing more, nothing less, because we don't do nothing to them. They don't live around us, we don't live around them. And the issue that I have with a lot of them is you really feel that way. Well, why don't you go move somewhere where the population is 90% you? They'll still stay in a place like Atlanta and not like black people. They'll still stay in a place like Houston and not like black people. When you go run into a lot of black people in Houston, Dallas, places like that. You understand what I'm saying? That's why some black people don't like doctors and don't like it. It's not because we don't like health care. It's the fact that we just don't trust them because of what's happened in the past. But, you know, I know this lady's upset and rightfully so, but she needs to crusade a lot more against her own, because her own is the problem. It's not black people. Because you know what? When you're sick and down, it should be you want the best person. But what if that black person got the cure to what your issue is? You gonna reject them? But they rather be sick. They rather die than have a black person do something for them. And that's okay. If you're that ignorant, maybe you shouldn't be here. That's how I feel about it.